Hi there, Elmarie again. I'm now going to share with you my 10-day after surgery visit to my surgeon. It was actually quite a bit more than 10 days after surgery. It was about 3.5 weeks after surgery, because after 10 days I felt so good that I actually went to church. Everybody hugged me, welcomed me, it was good to see me, but somebody had a little flu bug, which of course went straight for me, and I fell ill. So I stayed in bed for 2 weeks, and I decided to not take extra medication. I thought my body is strong enough, I knew it, to overcome this, but I did not do any exercises because I did not want to stress my body, coping with after surgery recovery and flu and exercises. So my appointment had to be postponed. I went to see my surgeon then after 3 weeks. As I arrived there on my crutches, but no pain at all. Arrived with my crutches, so I was in the examining room first, and he came in. I had to remove my shoes as well. So then he tested, well, first he looked at the wound, and he was very happy. I'm also happy. I'll show you a photo, but this is quite a bit later now, after it's totally recovered. And then he tested my legs to see the movement in my legs, my left leg as well as my right leg. He was happy with that, but then we had to go through to his consulting room, his office. And he said to me, leave your crutches, hold on to my arm and walk. And I started explaining, that I fell ill. He didn't even hear that because I immediately started limping. And he stopped, and he had this serious look on his face, and he said, my patients don't walk like that. And I realized, oh, girl. So we went through to his office, and he showed me the x-rays, the post-surgery x-rays. I couldn't stop looking. I was amazed, and I just kept saying, it is so clean. It is so clean. Because to me, it just looked so perfect and so clean. It is honestly perfection personified. I'll show you. And I kept thinking, that is inside my body. And it looks so perfect. And I do not feel it. Not at all. Not at all. And my surgeon did it. That just still amazes me up to today. But in any case, he then went and spoke to the physiotherapist. Her consulting room is 2-3 meters away from his. They chatted for quite a while, and then she came to fetch me. I said goodbye to him, went around to her, and the first thing she said to me is, stand on your one leg. And I was very confident. I mentioned to her that I didn't exercise for 2 weeks. She said, stand on your one leg. And I said, yeah, sure, because I thought back to when I was a child. We could do that easily. And I tried. I could not stand on my one leg. I couldn't. Neither of the 2 legs. I couldn't stand on my left leg. I couldn't stand on my right leg. And she said, yes, that is exactly what happens, well, after surgery, but also as we get older. Our balance goes, it deteriorates. And that's why many older people fall. I was shocked. I couldn't believe it that I couldn't stand on one leg at all. Not at all. Not for a second. My body just wouldn't do it. So she immediately gave me a whole set of new exercises to do. And I was very disciplined. I didn't go to church for a couple of weeks. I did not want to get flu again, and I was very disciplined. I did my exercises. But I also said to her, really, these seem like very, very simple exercises. She said, Elmarie, you just do it for 4 weeks and you'll see the difference. And I did. I was very disciplined. I still am. I still do my exercises. And the improvement is absolutely amazing. I recommend to everybody, make a video of your progress. I made a video of my walking every day for many days, and I share that with you. I share the exercises she gave me and parts of my walking in other videos in the series. So that's my post-op visit to my surgeon. All in all, a good experience. It's just that both him and I were pretty shocked that I limped so seriously. But that was because I didn't exercise. Please do your exercises. I don't know in which phase you are, whether you're still considering the surgery. It's the best thing you can do, because that pain and that limping is exhausting. Maybe you're recovering from surgery, but please keep in mind, be very careful that you don't slip or fall. That implant needs to stay intact, but please be disciplined and do your exercises. It's also our butt muscles that keep that implant in place, because there's nothing else, it just fits in. My left one has got screws into the pelvis bone. This right one just sits there. I'm amazed. I've asked my surgeon so many times, is that all? He says, yes. But therefore we need those muscles to be strong. It was good talking to you again. Have a lovely day, and I'll talk to you again in the rest of the videos. Bye-bye.